Okay, good morning and good afternoon, good evening, everybody, and welcome to this podcast, Reconcile. I'm going to hop right into introducing my guest, Dr. Rajive Jassal. We're going to hop right in. We're going to read his bio, we're going to open up the space and drop into a rich conversation that's going to cover a diversity of topics from work-related burnout to neuroscience and neurology to yoga and meditation to health, wellness, transformation. And here we go. Dr. Jassal has, for the last 16 years, had a clinical practice holding the position of clinical professor in the Section of Neurology, the Department of Medicine at the University of Alberta, actively participating in the education, academic half-day for neurology, physiatry, internal medicine, ear, nose, and throat, and emergency medicine residency training. His mode of practice is within the province of Alberta, again for the past 16 years and previously for 2 years in British Columbia. He's a general adult neurologist, electromyographer with competency in headache, stroke, and neuromuscular disease.
Thanks, Sean, for having me on. It's been quite the opportunity getting to join you on this podcast, and thanks very much for the introduction.
Yeah, well,
sometimes when we look at the breadth of one's experience, just by you reading my accolades there, it was quite something because it made me think about what is the importance. Many people who are in clinical medicine don't necessarily know all of these roles. So I'll briefly explain it to you because I think there is significance behind it. So once we as physicians graduate, we can decide whether we want to be affiliated with a university, for example. And many of us that are fee-for-service physicians compared to salary physicians, we actually don't associate with the university. And so we don't get our particular titles. So one of the titles that you first get is something called an assistant clinical professor. After 5 to 10 years, then you become an associate clinical professor, and then you become a full clinical professor. And to move through these ranks requires recognition in not only municipal level, but then provincial and then national, and then actually international. So in order for one to become a clinical professor such as I am, particularly someone who's fee for service, you must be doing something international. And this is something that many people don't recognize when we are sort of making our way through our career. So I just wanted to highlight that. And then the second part that I wanted to highlight, which was really quite something, was the breadth of exposure, having been with internal medicine, with emergency, ear, nose, and throat, physiatry, and neurology. So it seems like I have crossed a number of different paths as well, which is really important to know because all of the students that I've come across are really from multiple different subspecialties, like yourself in psychology, myself in neurosciences. And so that is a really important thing that I noticed as well when you were highlighting a little bit about myself professionally.
Well, something comes to mind here. Two things. One that surfaced as you were speaking to this. It's interesting because I didn't finish the second part of your bio yet, which included the elements of yoga and elements of your teaching background in that field. So maybe I might have just invite you to speak to that, unless you still happy to read it. It's really rich and beautiful. But before going there, something I'm tuning into, which might be a important piece to our conversation here, is as a physician and in all the different dimensions of being a physician, something I'm thinking of is pathology and disease model approach to thinking about the human condition and a non-pathological, non-disease approach potentially. That I'm curious if that might come up in our conversation. I imagine you have a lot to say on that, but I just tuned into that as you were speaking to that, and given that I didn't talk about the yoga part of your background yet.
Yes, so I think two things come up. So
yeah,
to get Yeah. I think for the yoga part, maybe what I'll let you do is, just so I don't steal your fire, I'll let you finish that portion.
Okay, why don't we do that? Okay, let's do that. I'll read this. So, Rajive Jassal has been practicing yoga for 25 years, over 25 years, beginning in Ashtanga Yoga Winnipeg, focusing on Mysore style practice with the late Jonathan Ostman. He continued his education at the Yoga Loft and Sattva School of Yoga in Edmonton. He's a 200-hour yoga teacher from the Sattva School of Yoga, teaches anatomy for the Yoga Teacher Training Program for the Sattva School of Yoga, teaches asana, dhyana, and pranayama classes on his own private weekly Zoom sessions for healthcare professionals' wellness maintenance. Dr. Jassal practices as a clinical professor in Section of Neurology department. We talked about that, internal medicine, University of Alberta. Adult neurologist with expertise in stroke, headache, and neuromuscular disorders. His yoga focus is pranayama and dhyana, using his medical knowledge to integrate the Western and Eastern neuroanatomical paradigms to explore the nervous system. I want to say that again. His yoga focus is pranayama, for folks who don't know. This is breath and breath work. Dhyana, which is concentration. I imagine Rajiv will speak more to that. Using his medical knowledge to integrate the Western and Eastern neuroanatomical paradigms to explore the nervous system. He is co-founder of the Reframed Resilience Group, Edmonton-based agency focused on empowering medical professionals to participate and co-create their own wellness as leaders in healthcare. His partner, Dr. Kristen Yont, DMD, are partnering with local and national colleagues in leading future Canadian physician-led wellness body and mind interventions, seminars abroad with his experience with yoga. His future pursuits include SMART, which is stress and management and resiliency training, certification through the Benson Henry Institute at the Massachusetts General Harvard School of Medicine, and Ayurveda Yoga Practitioner Program, study at the California College of Ayurveda Premier Ayurvedic Herbal Apprenticeship. Dr. Jassal.
Thank you very much. Yeah, that was fantastic.
Mm-hmm.
I think a good dive here is exactly what you highlighted. So you had read one sentence twice, and I think this is a strong part of my medical practice. You know, when we think about how it is that we want to practice medicine, and you know, you had brought it up earlier in the sense that, you know, do we base it on a disease model and pathology, or do we base it on a wellness model? And I think it's a combination of the two. So of late, my practice has been a combination of medication and meditation. So many of my patients will come to see me and we will begin our discussion with the Western pathophysiology. For example, if I'm seeing a patient with myasthenia gravis, which is a junctional disorder where the nerve and muscle don't talk to each other, I explain to them that this is a nerve, this is the muscle, and the two of them are just not talking well. And as a result of the lack of communication between it, there's this area or this space in between here called the junction. And this is the junction that I want my medications to work at, but then also this is where your meditation is going to work at. And so by visually demonstrating to them, this is what the muscle looks like, this is what the nerve looks like, and then this is what the junction looks like, I walk them through a short few-minute meditation to begin to understand this space, the junction, and the different components of it. Because not only do we have to visualize it, but we have to then provide names that they can associate with this. And so, for example, in the junction, one of the most important things would be acetylcholine. And acetylcholine being a very important molecule and the receptor that it binds, just demonstrating them that this is what the molecule, this is what the receptor, and this is what a healthy co-joining of the molecule with the receptor is. And I find that that's very powerful because then they know that the medication that I'm giving them is helping this, but then they now have control of themselves and they can then focus on this meditation of this communication occurring. And so we joke a lot about it, but you know, I think this is the way of the future where practitioners like ourselves are going to be using a combination of medication and meditation to make our patients better. And so we are using the pathology model. We're still showing them what is wrong, but then we are using the model of wellness in the sense that we are giving them the control back, which has been lacking for a long time for these patients, that they feel almost vulnerable or a sense of helplessness, that they're not able to uh, perhaps take care of their own disease. When in many cases, many of them do have control, but they just don't know the words, they don't know the language, and they don't know the form that it takes. And that's just our job, and our duty is to show them the path.
It certainly stands out to me. I mean, I feel as though many of us have perhaps had medical experiences or doctors. I've heard it many times in my own clinical practice where some people kind of, it's like the pathology disease model is running more dominant, and a psychiatrist or a family physician just prescribes the, let's say, antidepressant, an SSRI or something like that, but they're not speaking to what sounds to be more like the way you're approaching it, which is including both honoring particularly the empowerment of the individual to evoke for themselves through various forms of meditation, which I think would be nice to hear a little bit more about your thoughts and what you do share with clients. But that just
Mm-hmm.
really stands out to me.
Yeah,
Yeah.
I'm happy to elaborate a little bit. I
Mm-hmm.
think I think I'm happy to elaborate because I think when we talk about meditation, and earlier we are talking about some of my focuses being the pranayama and the dhyana. When we talk about the concentration, and we look at how can we empower our patients, the most important would be to develop this level of concentration that we can, for short periods of time, the patient can hone in on something that is really important for their particular disease. And whether that is, in this example I gave you, a deficiency of the communication between a receptor and a molecule.
Mm-hmm.
But we have to keep it very simple. And that's what I generally do, because to create something that is complex for an individual takes time. And if we want a patient to be consistent over a prolonged period of time, which is the key to success, we need to keep the meditation simple. And so, in many ways, the simpler the meditation is that you empower someone with, the more powerful it becomes in itself.
Mm-hmm.
So, most of my meditations are concentration driven, are very simple driven, and are very easy to reproduce at any given time.
Mm-hmm.
And that I think in a, is sort of a summary of what I would do for patients, at least, that are very introductory in
Mm-hmm.
my practice.
Yeah. God, my neurons are firing in many different directions with this topic. One part of me wants to hear maybe you share an example of a guided meditation, something you would teach a
Mm,
patient, but on the specific condition example of a patient where there's a miscommunication happening
hmm
between neuron or motor neuron to muscle, and this
hmm
this field of yoga and like physical movement as a mindfulness based practice. I imagine there's probably a lot to be said also there when supporting people in integrating a movement based practice there.
hmm
So any direction you want to go there? Do you want to share a meditation? Do you want to speak more to the importance of movement as a mindfulness practice?
Yes, I think when we look at this one condition, so if we look at the example we've been using, which is myasthenia gravis, and myasthenia gravis being a patient with, say, ocular disease.
Mm-hmm.
So someone has ptosis or droopiness of one eyelid,
Mm-hmm.
and they're having difficulties with their vision and focusing. So the idea with the meditation would be sort of focusing on the molecular level, but then also, perhaps doing an open eye meditation where they're visualizing in a mirror what their eyelid is looking like, and remembering times of the day or times when the eyelid is very open. So, for example, first thing in the morning or after a nap, the eyelid is a lot more open. And remembering that experience and then trying to embody that experience when, for example, they're tired, or, for example, when they're finding that their symptoms are more bothersome, long driving, for example,
Mm-hmm.
and then allowing that sort of meditation then to come back, that visualization to come back to them so that they can remember, and then using the central nervous system to assist the peripheral nervous system, which is not working. So, for example, in this example, if the patient remembered first thing in the morning that their eyelid was very open, that memory is locked into the hippocampus. And the hippocampus is deep within the central nervous system in the mesial temporal structures, so just in the temporal lobe.
Mm-hmm.
And then once that memory is required at a later point by the prefrontal cortex. So, for example, if somebody is meditating, then later in the day when they're driving and their eyelid is getting tired, they remember the meditation I told them, which is the prefrontal cortex being activated.
Mm-hmm.
The prefrontal cortex is activated just by focusing on a mantra or focusing on that visual aspect of the eyelid opening up. This then fires back into the temporal lobe, into the hippocampus, takes out the memory. The memory was from earlier in the day or when they were more rested. And then that information then goes down into the peripheral nervous system. And the anticipation then is that the intent is enough to open up the channels to get a bit more acetylcholine in that area, and then the eyelid to open up. Obviously, it doesn't happen overnight,
Mm-hmm.
but I think with sustained practice, patients say that it is working.
Wow.
So it must be working.
So this would be an example, like patients reporting back, a combination between meditation, meditation.
Mm-hmm.
There's a neuroplastic change happening in the brain that's supporting
Mm-hmm.
a shift, a change in neural tone to musculature, and like so much more can be said. That's not less my realm of expertise, but
Yeah,
neuroplasticity is coming to mind.
that's right. Yeah, and
Yeah.
it's looking at the areas that are not functioning smoothly.
Hmm.
And then, as we talked earlier about the pathology model versus the health model, then using strengths towards your advantage. So in this case, because the problem is mainly in the peripheral nervous system, by strengthening the central nervous system with deeper levels of concentration, then using that as a muscle to become stronger, more toned, and then more able to affect the peripheral nervous system so that the deficiency is then activated on rather than being helpless to it. We're actually doing something about it, and we're actually making those kind of changes, as you mentioned, in the brain. I tend not to use the word neuroplastic just because the word is so ubiquitous
Yes.
in the literature. So I try to be a bit more specific so that everyone understands that there is a distinct pathway. And this distinct pathway, once it is taught to you, is easy. Prefrontal cortex, temporal lobe, and then the execution begins to happen. And we can talk more about different parts of the brain and as we go through the discussion, and we certainly will. But these are the simple ways to get the junction going, especially with the example that you wanted to talk about.
Yeah. Not only neurologically is the junction, being taken care of, but what's really standing out to me, and it's partly like you could say elements of my bias or interest in human growth and development and empowerment and wellness, is supporting the individual to you talked about there's a tendency maybe for people to feel a bit like or express helplessness, and that can be maybe also projected onto a doctor and fix me, give me the thing to fix me. But this option, this model of supporting somebody to also learn and become a little bit more empowered sovereign and internalize the authority for themselves, that they also
Mm,
play a role in this change, whatever it might be. I'm
mm,
actually curious to expand this into other dimensions of behavior change and psychological growth and development. Um, but
mm.
that's coming to mind
Yeah, I
is,
think.
yeah, go
Mhm.
ahead. Go ahead.
Yeah, I think what you talk about is the agency. So I think
Yeah.
when we're speaking now, the agency is very important. So in most medical disease, many patients have lost their agency,
Mm.
and so the agency is in the posterior cingulate gyrus, and so the PCC is just right here.
Mm.
And the PCC is a very interesting area, and it's right beside the other area called the insula. So both the insula and the PCC are very responsible for one's agency. And this is exactly what you talk about is this learned helplessness or
Mm.
this ability then to return to the body. And this is why yoga, amongst other practices, Tai Chi, Qigong, etc. But returning the practitioner back to the body so then they understand that this is my arm and this is my head. And as a result of it, I have control over it.
Mm.
For example, pain and addressing the pain that might be in my head for a migraine patient or pain in my arm for various musculoskeletal reasons. And this return to the body that yoga and some of the other arts that I just talked about is that they have a body predominant focus to come into.
Mm.
So the agency of this person then begins to wake up again. And then there's this refamiliarizing ourselves with our arm, with our head, and then beginning to understand that I am not my head and I am not my arm, but rather these are just parts of my body and this is part of my overall body. And I must address this as I can.
Mm.
And this then gets into some of the other aspects of yoga that you talked about, whether this is pranayama or dhyana. And in many ways, we can then deepen the person's practice if they're interested in it. You can go a bit deeper. And then with the neuroanatomy I just talked about, you can then take some of the breath from pranayama and you can actually take the prana to the posterior cingulate gyrus and to the insula. And in fact, then during your meditation practice, you can focus right on those areas. And there's been great studies, fMRI studies, functional magnetic resonance imaging.
Mm.
So this is not just a still picture of the brain, but functional. So areas of the brain begin to light up depending on the function that the person is requested to do.
Mm.
And so in these examples, patients are requested to think about agency, to think about their head, to think about their arm, and then the PCC and the insula light up and showing them that these areas are lighting up or these areas are activated shows them that they have this level of control and this learned helplessness begins to fall away. Pain behavior begins to fall away. They don't identify everything to be related to their pain, but rather that pain is a part of their experience, but that they can then have X, Y, and Z as alternate thoughts, activities, behaviors that they may choose if they want to.
Mm. Mm. One of the things that stands out most from what you're sharing here, in particular, again, from the perspective of human growth, development, and wellness promotion, let's say, is the shift from learned helplessness, which perhaps many people come to that posture towards life and self from various angles and for various reasons. But the shift from learned helplessness into learned effectiveness is what's coming to mind. The other thing that's coming to mind is the role you or I or any healthcare provider or yoga teacher or coach may be playing in a person's support network to encourage them to believe. There's something here coming up around belief that it's actually worth trying this. I don't want to dismiss the possibility, for example, that somebody like you telling somebody or encouraging or teaching them to try this meditation technique carries a lot of gravity for them. Like, okay, holy, Dr. Jassel's like encouraging me to meditate and like giving me all this incredible information. I'm going to try that. I believe. Any thoughts on that?
Yeah, a couple things come up. So
Yeah.
I think the first thing is to discuss the reframed resilience group. So Kristen and I had created this reframed resilience group, and we were very mindful not to make it just related to physicians, but rather a group of people. And we wanted it to be open access, very much like the literature has open access and the internet and artificial intelligence and ChatGPT
Right.
has open access. And we wanted to reframe how everyone is looking at health and wellness. And we want to develop a group of resilient practitioners and resilient interventions. And this is why this particular group was named. And hopefully one day you too will be part of this, John, which is one of the reasons that I am on this podcast. And interesting that you bring up Satya, so the truth. The truth is eternal. And beyond any gravity, the gravity of a physician is of the greatest nature. As you know, you can't buy health. And so as you can't buy health, when a patient comes to you and talks to you, and you're right, if I'm bringing up something like meditation in the clinic with people, this is quite something. In fact, many of the patients come back with their family members at a later point at the subsequent visits, and we always joke about the fact that the medication is not so much what they're interested in anymore. And many times before, where I would have to explain the side effects of this medication or the necessary screening blood work, most of the conversation is now revolving around, can we sit down and can we do that meditation again? Because I really want to ensure that I got it right, so that when we go home, we practice it every night together, that it's very clear. So there's this satya, or this truth, that they know that it is there. And so because they know that it is there, there's a hunger for it and more of a desire for that. And this is also why, in many ways, our journeys are combining the two. And in many ways, in the East or in the West, whatever way you look at it, many of us have crossed the borders and we are bringing gifts of our learnings and teachings to the other, but we are also becoming contaminated with the others. So many of the East that are coming here to the West are becoming contaminated with the diseases of the West. And many of the West who are going to the East are getting contaminated with the philosophies of the East. So we must be mindful about everything that we are doing, and that at the end of the day, I am a neurologist. And when I am practicing my medicine, I have a choice to do it a certain way. But if for whatever reason there's a complication that comes up, we must be mindful about that and always try to practice within the realms of our teachings, because this is the truth, and this is the satya that we speak of, meaning that as much as I can meditate about a junction and hoping to keep that person out of harm's way, meaning ending up in an intensive care unit, the reality is they will end up in an intensive care unit at some point. And despite that, rescue medication will be needed. And so keeping that at the forefront of all of our conversations as well, because many of my patients sometimes go a little bit too far down the other end and say, well, can we stop these medications now? Because I think my medication is not as good as my meditation. And I say, well, I think they both have a role here. And so just as I continue to read lots in regards to neurology, I also read a lot in regards to yoga and the Eastern arts.
One thing that I'm hearing in that reflection is, in part, perhaps not denying the reality of somebody's condition, that there's there's relevance and validity to certain interventions that would be supportive of improving the quality of someone's life. But also on the topic you're speaking of, our finitude, our mortality,
Mm,
the fragility of the human condition, that we
mm,
are temporal beings in a relative existence with bodies that will fail someday in various ways. So I'm moved by just tuning into that element of that reflection,
mm,
not denying the truth of our existence as mortal human beings.
mhm.
And we got a life to live here, Rajiv.
Absolutely.
There's some flourishing that can be happening. Like there's some joy to be had, and some trauma to be grieved and processed and moved through. And that we had initially a seed topic of work related burnout as well. That there's people that are going to be listening to this that are, you know, working their asses off and asking themselves, like, is it possible to feel, more balanced, more sane, to improve my nervous
Mm,
system health and my mental health here?
mhm.
I wonder if we shift a little bit towards that angle, and how meditation, yoga might be sort of a unique, element of our conversation, and bringing this practice in for people who haven't maybe been exposed to it, this experiential wisdom.
Mm. Yeah, absolutely. So I think, first of all, a definition is always in order. Burnout
Mm.
is a work-related experience. And so when we look at experiences, many practitioners feel that burnout is something that they did. In fact, it's not. The number one reason that burnout exists now is because it's often an institution or a work-related intervention. So what's happened during COVID-19 is many of us thought, oh, we're getting smarter because we're working remotely. But in fact, many of us lost the boundaries that we had between work and play. And as a result of it, everything just became work. And we no longer have the idea about set boundaries on when play is to occur. Many clinicians, we really felt this because we were asked to do things during the COVID pandemic that was unbelievable, working hours, working in divisions and departments where we didn't have our level of expertise. And so, where burnout then began to really wreak its havoc was we were all exposed to these work hours that was greater than our bodies and our minds could handle. And the result of that is that the quotient, so there's always a stress monitor, and I think the stress monitor is like when we sit on those teeter totters when we were young, and it would always go up and down. And so we call this allostatic load. And allostatic load means that there is only a certain amount of resilience that you can handle before you enter the red line. And many of us know what this red line is. We are got another project due, and our wives want us to go for dinner, and our laundry needs to be done, and our bills need to be paid. And so it's this idea that we are redlining because there's just far too much that is going on. And as a result of the fact that far too much is going on, uh, something breaks. And when this break occurs, this break can be physical, this break can be mental, and catastrophically, both of them are linked in the sense that many times a sore shoulder then becomes a bit of arthritis, and then the arthritis becomes a shoulder replacement, and then the shoulder replacement ends up becoming bone cancer. And so this is the ultimate paradox of the physical and the mental, and this is why it's so important to be mindful of both categories. And so I think the rub here is keeping it simple. I think you've heard me say that
Yeah.
through the podcast, and this is what I teach. So I say, listen, you got 5 minutes in the morning. I need you to do three postures.
Mm-hmm.
I need you to do a standing posture. I need you to do a sitting posture. And then I need you to lie down. And then that's it.
Mm-hmm.
So those are three postures. And if you can give me 5 minutes, that's all I need. And that's your yoga practice, meaning
Mm-hmm.
that you've decided that first thing after you pop out of bed, you put your mat right there, you unroll it, and you do a couple of postures. And then there's a bonus opportunity, meaning that if you've got an extra minute or two after, you can do a bit of breathing, and then you can close your eyes and you can sit in meditation for another minute. And you've had a 10-minute practice,
Mm-hmm.
and that's your practice for the day.
Mm-hmm.
And it's interesting because most people say, well, I can't even consider that because I would have to put on my pants, I would have to go to this yoga studio, and I would have to, but the reality is that we have this ability to do it anywhere. But many of us feel that there has to be a larger production, 45 minutes, 1 hour, when in really just a few minutes is all we need. And so as the excuses tend to turn up by that point, saying that, oh, I'm not a morning person and etc., then the next thing I say is, well, at work, you have a few minutes between clients, you have a chair here, let's sit down and I show you how to do a couple of minutes of chair yoga.
Yeah.
So we sit down and so I think the idea is that if we can make it simple, we can make it portable, but the idea is that you must practice.
Mm-hmm.
And when we talk about this idea about must practice, it is one of the most simplest parts of human development, which is consistency over a prolonged period of time.
Mm-hmm.
So in yoga, we talk about swadhyaya, which is self-study.
Mm-hmm.
We talk about Ishvara Pranidhana, which is a devotional component, and we will come to that a little bit later in the podcast, because that's very important to get to. But this swadhyaya, the self-study component, is very, very important. And this is the mitigation to burnout. So how do I study myself? Simple. I know myself better than anybody. I know what time I wake up. I know what time I sleep. I know how many cups of coffee I like a day. I know how many times I'm going to go to my Instagram account per day. It is self-study. And so as a result of this knowledge that we have of ourselves, we can put together simple techniques throughout the day to ensure that we are preventing any possibility of burnout developing. And we know that the burnout is there. We then begin to learn to study ourselves and say, oh, I'm actually getting pretty tired. I should probably get some sleep. Or I begin to realize I'm getting a bit maybe short with other people. I probably should take a 5-minute breather. I know that I've taken on a little bit too much this week. I should say no to the next opportunity to go socialize with somebody. And these are the tenets that we begin to understand about ourselves the more that we begin to give time to ourselves. And this is the crux of it, is that only by being good to ourselves and truly having the devotion to ourselves can then we be good to others. And we know this. We know this because when I'm rested, when I'm not so busy, I tend to interact in a more humane way, and I tend to look at opportunity rather than looking towards closure. I look to socialize rather than look to isolate. And these are key tenets that we see time and time again when a practitioner is healthy. And when we see those signs of withdrawal or signs of physical tiredness, falling asleep, aches and pains in the body, these are all the warning signs that we know are coming to us. Headaches. We know that these are all the warning signs coming to us, telling us that we must reevaluate, we must do more self-study. And the easiest way to do self-study is to study yourself with yoga.
Yeah. Wow. I really resonate with everything you're saying there. one of the things that stands out there is, you know, on the topic of svadhyaya, for folks who maybe haven't heard that word before in yoga, this is a niyama. It's an observation, an approach to life, an approach to oneself, to choose to have the willingness to study oneself, to self-examine, to investigate, to pay attention. One of the things I notice in my counseling practice, my therapy practice, is a lot of people haven't had the mirroring to them, the almost, yeah, the environment to even think or pay to feel the value or importance of paying closer attention and acting upon that knowledge of feeling the warning signs. Like I like want to say, I perhaps like yourself get people at times when they are in the burnt out zone, and it's now they need to really address what's going on, or their window of tolerance has been crushed, and their capacities to function healthfully, adaptively, flexibly in the world are really challenged. And that's that breaking point where they come for counseling psychotherapy is like, I've hit rock bottom. I don't know what to do. And so that's what comes to mind here is
Mm.
perhaps those times in life, those chapters where, yeah, the burnout happens, the fatigue, the nervous system breakdown, the
Mhm.
bottom depression, the panic attacks, like these signs and symptoms that have gone to the red line. And now it's time to, like, that's maybe where the healthcare practitioner comes in, is like, this is the svadhyaya. It's time to take an honest, close look at the way you're living and inquire, is there a way that I'm living here that I have some responsibility over, perhaps, that I can take some agency over, to have some
Mhm.
influence, to move in a direction of, well, in yoga, the opposite, ahimsa comes to mind, non-harming.
Mhm.
This is a lifestyle inquiry that comes to mind often in my work with people, is the way they're living, working, it's out of balance. It's almost like it's contributing harm to them, but they keep going, and then they hit that wall, and then they come to see a clinical counselor, their family doctor, whoever. So this is a really rich topic in
Mhm.
summary.
Yeah, and I
Yeah.
and I think that I think you bring up a good point there because in many ways we are seeing people at the red line, and when
Mm-hmm.
tertiary or quaternary level of care. So everybody who's listening to this podcast, primary would be just not smoking or just not drinking.
Mm-hmm.
And secondary care would be that then you've had a stroke and then you're told not to smoke and then you do it. And then tertiary care and quaternary care is when you've had a stroke and you've had something very disabling occur from it. And then we are trying to rehabilitate you and bring you back into um, care. And then if you happen to have a blood clot in your heart and you need a cardiologist and a neurologist, then you're in the quaternary level of care,
Mm-hmm.
which means subspecialists involved in your care. So many ways, I feel like I do see people at the spectrums. So I see people quaternary care, and and then I see people in the primary care. And I talk about this, and we talk about the yamas and the niyamas, and you brought this up. And so, just summarize it for everyone. So,
Mm-hmm.
the yamas are disciplines to prevent bad habits, and then when you focus on the good habits, these are called the niyamas. And the niyamas are just constraints or um, things that we focus on. And if a practitioner focuses on the niyamas and keeps their gaze at that level or keeps their attention at that level, it's almost such that then there is really no need to fall back into the red line because one of them will come up. And I think we've talked a little bit about ahimsa, no harming.
Mm-hmm.
There's other ones like brahmacharya, which I think is really important. And so
Mm-hmm.
many people think brahmacharya would be something of continence or chastity, and this idea about not being sexual or not expressing our sexualness. And I think in many ways that's not what brahmacharya is about at all. Brahmacharya, in my mind, is about how do we live a fulfilling life, like you mentioned, like how do we have a great life and how do we have a fulfilling life, but recognizing that if I am to have a podcast with you for an hour, that means that I would have to prepare for it earlier in the evening by taking the necessary time to prepare for that. And this is in many ways brahmacharya, meaning how do I contain myself throughout whatever experience I'm about to enjoy.
Mm-hmm.
And it doesn't mean that I can't have a cocktail later tonight, but perhaps I'm not going to have 5 cocktails tonight.
Mm-hmm.
And this idea about continence and keeping a certain amount of enjoyment, but maybe not going overboard with it. At least that's what I think about when I think about brahmacharya. How about yourself, John? What does brahmacharya mean
Yeah,
for you?
well, a couple things. So I feel as though we come to understand through self-study, again, svadhyaya, this dimension of kriya yoga, the yoga of action, that we play a role, an actionable role and influence on our life experience. And so through this self-study, we come to understand, as I see brahmacharya, sort of an awareness of and containment of our life force energy. I think this is so pertinent when it comes to just our general lifestyle in all the integral dimensions of our being, from work to relationship to self-care practices to habits to addictive behaviors to substance use to partying to celebrating. It takes a degree of self-awareness to know for oneself what is too much. Nothing in excess. Nothing in excess is one way I've heard brahmacharya sort of expressed in a simple way as well. And so, well, it's, I sense my brain going in multiple directions, tuning into the neurology, the neurobiology of habits or addictions, whether it's substance use addiction or behavioral addictions or habits. I've even grown to be less fond of the word addiction and just say compelling behaviors. But in counseling, for example, maybe this is an interesting bridge for furthering the conversation. I talk to many people who have some awareness, it seems, that the way I'm doing life and my behaviors right now is killing me. How do I change this? It's like these behaviors are so compelling, or the substance is so compelling. From the topic of brahmacharya, like having the 5 cocktails is really influencing my health. Or, the addiction to social media is contributing to burning me out. But it's like, this is an interesting topic because at times they're like a coping mechanism to deal with the stresses of life. But they recognize they're maladaptive habits. So there's a pattern of maladaptive habits going on that perhaps you might comment on it as well, behaviorally, but neurologically developing patterned tracks in the brain for repeating, as Sigmund Freud said, repetition compulsion. And so I'm always interested in what helps somebody, and I think it really deserves to be spoken to around developing individualized practices that meet a person where they're at with their own unique intelligences, and cognitive diversity, neurodiversity. But what interrupts these patterns and what replaces them is a question I often sort of entertain with myself when I'm developing treatment planning for somebody, and how can I meet someone in a way that speaks their language and connects them with their own intelligences to develop, just to bridge the yoga, a form of balanced discipline that's not actually harming or shaming and setting them up for failure, but setting them up, as you mentioned in our beginning, setting them up for success and empowerment.
Hmm. I think this is I think this gets into the Ishvara Pranidhana.
Uh-huh.
And so in yoga, the Ishvara Pranidhana is a devotion to a higher power.
Mm-hmm.
And in many ways, this higher power is ourselves. And then this devotion is a self-devotional. And when you speak of meeting people where they are,
Mm-hmm.
for example, this person knows that their behaviors are maladaptive.
Mm-hmm.
And so we just outline them and say, okay, well, my example recently in the quaternary level of care was a crystal meth daily user
Mm.
who had two children, had a disabling stroke, had a blood clot in his heart, and he didn't want to die.
Mm.
And we said to him, you won't die. We'll be here to save you, but what are you going to do afterwards?
Mm-hmm.
And he recognized all of his maladaptive behaviors
Mm.
about not spending time with his children, making excuses, daily crystal meth. And he asked me, he says, do you believe in a higher power? And I explained to him something called Ishvara Pranidhana. And when I explained to him Ishvara Pranidhana, I didn't use the words God, I didn't use the word religion. I just used this higher power, something that is greater than ourselves that we know can restore us to sanity. Some of us may have heard that from the addiction literature, but also in many ways, it is just our own knowing that what we're doing is not working.
Mm.
And so taking that extra step now to trust in the fact that there is something that's greater than ourselves to help us along this journey. And eventually, then we get back into that place of power, that place of authority, once our agency is restored to us. And we then begin to make those decisions and we then begin to make those choices that are healthier for us.
Mm.
And this is why self study without Ishvara Pranidhana many times fails because the
Mm.
practitioner will self study but will not have a devotional practice. And this devotional practice is what separates many, many fields from yoga because yoga has a devotional component to it and many others don't. And so this is one of the main tenets, I believe, of why the practice of yoga is so powerful.
Mm. Yeah. Wow. Thank you so much for sharing that example. I'm going to share, it's a moving example. My my heart is moved in the example you
Mm,
gave, and I'll share with you why. Um, in the example you gave, I'm hearing a man, a father of two kids, who has a subtle awareness of maladaptive coping strategies with life and an addiction or compelling behavior towards crystal meth, which nearly or potentially would have killed him. And I can empathize with or imagine what stirred for him, and what you kind of commented on. Sort of to qualify that, it sounds to be like somewhat of a near-death experience. That's a close
mm,
call, that one. A stroke and a blood clot in the heart. Maybe you could elaborate on that, but that's without medical attention, you're probably going to die with that. Maybe you can just,
hmm.
is that yeah, okay,
Yeah, absolutely. I think that
right,
that's a very severe condition. Yeah, and
yeah,
it's
okay.
yeah, exactly as you had said.
So, but I tuned in, like the heart of my human being tuned into the next thing he said is something there about the love and care for his children.
Hmm.
Like this scare, this near death experience probably terrified him and also awakened his heart
Mm-hmm.
to what's really important. Almost like that direct experience sort of stirred for him the connection to life and value and devotion. You asked an important question that well is a lively topic in psychotherapy and psychedelic psychotherapy in particular, or people going to have ceremonial experiences with various entheogens and having profound mystical experiences, life altering events, experiences, near death experiences in medicines. And on the other side of this near death experience or mystical experience, profound life experience, what are you doing after you had this experience? Now what? What's next? This is the topic of integration and lifestyle change. How are you going to
Mm-hmm.
live the values and the heart-filled devotional, meaningful things that were shown to you after that experience? This is a rich terrain of inquiry for me, and in
Mm-hmm.
the field that I think we're in.
Yeah, and I agree with you. You know, we haven't talked about the chakras, but the chakras are wheels of energy that are at least mostly along the spinal cord, and then some are in the higher centers. And this one chakra that we got to together was the anahata, or the heart chakra.
Yeah.
And this is very important because in moments of death or near death, uh, a patient will open up their heart chakra enough to actually allow the Ishwara to come in and allow the devotion to be seen. And this is in many ways why the Anahata chakra, in many ways, is the most powerful, because it is the highest likelihood of being open just before death occurs. And in many practices of the Anahata, you do actually die. And so, and then you are reborn. And so, in many ways, I felt that when we had this experience together, literally the blood clot in his heart probably was one of the main reasons that his heart chakra had opened, and that he was then open to this idea about uh, spirituality. And in many ways, I think he did have a spiritual awakening at that point and came into connection with himself and has transformed himself. Because you're right, after this, I have no way of knowing for certain, but in many ways, I know in the grand scheme of things that, he has gone, and his intention now is to move forward and spending more time with his children and stopping the behaviors that are maladaptive, because he's had a spiritual awakening. And I think as a result of these spiritual awakenings that many of us have, and hopefully more of us will have them before that level of severity exists. Um, but many of us can have this on a day-to-day basis by doing simple practices. We don't
Yeah.
have to let it necessarily get to that level of seriousness before we decide to act upon it. And this is a little bit about how we do prevention in many of our day-to-day activities. How do we prevent this burnout, or how do
Yeah.
we prevent this things from creeping up on us?
You know, something I'm tuning into there. So integrating new habits, integrating practices. Maybe we'll talk a little bit more about explicitly practices within the framework of the 8 limbs of yoga. Perhaps we could go there with the remaining time that we have. But that fellow you're describing, he has a near death experience. His heart opens. Anahata, to use the chakra cartography, the yogic anatomy of the energetics. But it's like those habits were like, and the patterns of his habits and habitual ways were really interrupted there. And he had a spiritual awakening and was shown how much love he has for life and his children, for example. And what I'm curious about is, I guess I wonder if you might speak to a little bit on the neuroscience of habits. And it's just interesting. You say we don't need to have a near death experience to change, but it seems like that's been the catalyst for a lot of people.
Mm.
They need to have some big smack in the head or an accident or something to have to make a life change. But I resonate with you when you said we don't need to have that, but oftentimes that is what happens for a lot of people. It
Mm.
seems to be an interesting movement in our cultural atmosphere around the psychedelic world is
Mm.
pattern disruption, interrupting the toboggan tracks that are continually traveled to open up new
Mm.
pathways of possibility to then integrate new
Yeah.
wellness practices. It's a very, very rich topic here.
Hmm.
Yeah,
Yeah.
go ahead. Yeah.
Yeah. I think what we can do is we can talk a little bit about neuroanatomy. We can talk a little bit about pranayama, and we can talk a little bit about dhyana. So when we talk about the eight limbs of yoga, we've touched a bit about the yama and the niyama, which is generally from Patanjali talking about the first two limbs, the third limb being asana or posture, fourth limb being pranayama, which is breath control, and then fifth is pratyahara, a withdrawal of senses or to the sense organs, and then sixth is the concentration, which is dharana, and then meditation, seven dhyana, and then finally samadhi or enlightenment as the eighth. And these are all a spectrum, and at any given time, a practitioner often will move between the different eight limbs and recognizing them, hopefully, in their practice. So when we look at a habit is formed mainly because of this built-in memory system that we have. So we talked a little bit about the hippocampus earlier. And so the hippocampus is a small little structure deep within the temporal lobe. And then beside it is the amygdala. The amygdala is the bigger brother of the hippocampus. And the amygdala's job is essentially to regulate everything that comes to his little brother. So the amygdala is a very reactionary, very protective bigger brother. So anytime somebody annoys him or somebody gets emotional with him, he tends to react quite quickly. And his reactions are very disastrous in many ways. We reply quickly with a text message or an email without thinking about what it is that we're about to do. And then we push send, and then we regret it afterwards. And so what begins to happen is this habit of sending inappropriate text messages or inappropriate emails is because the bigger brother, the amygdala, tells the smaller brother, the hippocampus, I want you to do this. And the hippocampus, the little brother, all he knows to do is to remember. And so all he does is remember time and time and time again. And then his action goes forward and then the brain completes it. With the practice of pranayama, which is breath control, we have different nostrils, the right, the left. The right nostril, we say, joins to the left hemisphere. The left nostril joins to the right hemisphere. So simple exercise I tell everyone who doesn't believe me is if you have to do something very intellectual, I want you to breathe through your right nostril 10 times before you do that very intelligent thing. And then if you need to have a conversation with your wife and you don't want to get into any kind of argument, I want you to breathe through your right nostril because this is going to, sorry, your left nostril, and this is going to control your right hemisphere. And so the idea here is that you can have actual control of the hemispheres. The left hemisphere is the cognitive, the reasoning, and then the right hemisphere is the more artsy, the more emotional brain. So the idea here is that by practicing certain simple breathing techniques, we can actually activate different parts of the brain. So the idea then is if we take it a step further past the breathing technique, but now into the concentration. So if I can concentrate on just the front of my brain, which we call the prefrontal cortex, and in many ways, in most meditative practices, which we call single pointed concentration, single pointed concentration, you're focusing at a single point, you are activating the prefrontal cortex. The prefrontal cortex is one of the parts of the brain which then can feed back to the amygdala and say, chill. So it's sort of a way that the bigger brother gets a signal from the prefrontal cortex that says, chill out. And so the prefrontal cortex, the larger it gets, the more a practitioner practices meditation and their pranayama breathing techniques to activate the hemispheres and have greater control of the hemispheres, the more it is able then to talk with the amygdala and to create a 2-second calm. And it is this 2-second calm that then allows the amygdala to shut down enough for the prefrontal cortex directly to talk to the hippocampus and say, hey, listen, I'm going to tell you something different now, or I'm going to give you some new information. And you're going to be a bit more calmer this time because your bigger brother is going to say something to you, but it's going to be a bit calmer this time. And I want you to try something different. And so what this difference is maybe thinking before you send that email, or this is maybe putting that email into a drafts folder and then addressing it the next morning when you are well rested. And so this time capsule that begins to open up, and you may have heard of this top-down thinking, bottom-up thinking.
Yeah.
And so this is really the top-down thinking that by activating the prefrontal cortex, we can then begin to manage the way that the hippocampus and amygdala are firing. And then as the practitioner becomes more and more advanced, one of the ideas becomes mantra. So mantra is a word or an object or a concept that the practitioner holds onto. Many times early on, the mantra is a voice or a word. I am happy and all the causes of happiness come to me. I allow all the pain and all the causes of pain to leave me. This would be a simple mantra that a practitioner could say over and over to themselves again. Or instead they could hold the image of a heart right in front of their single pointed concentration. So then the mantra then is a heart. And then eventually the mantra can then become a deity. So that if we have a particular Ishvara Pranidhana that we are focused on, whether this is a Hindu god or a Hindu goddess or a Tibetan goddess, we can hold that image, and then we eventually then take the characteristics of this god or goddess. So the idea then becomes is with mantra, whether we are using auditory, the auditory uses the temporal parietal junction again. If we use visual system by holding the heart there, we're using the occipital lobes of the brain. And then if we are using the form complexity of a deity or a goddess, this requires multiple areas of the brain. And so then the idea then is becoming now as the practitioner is becoming increasingly more complex with the use of their brain. And by activating multiple different areas of the brain, they have that much more control over what the hippocampus remembers. And so then if the hippocampus then says, okay, well, now I'm not dependent on my brother who is feeding me quick reactionary messages, but now instead I am rich. I have multiple sources of information, whether that's spoken, whether that's visual, whether that's integrative based on other aspects. I can now react and I can remember patterns that are then more conducive to a healthier lifestyle. So rather than being reactionary in the sense that, oh, I'm sad and depressed now, I'm going to eat something, and then that food ends up being my solution for my depression, I then instead say, oh, I am now depressed. Okay, where is my depression coming from? Oh, right, my depression is coming from the fact that I'm looking at too many YouTube videos with my occipital cortex, and I'm listening to too many podcasts on good quality exercises that I can't do because I'm overweight. And this negative information and this negative voice that I keep hearing to myself over and over again. And so these are the different components then the practitioner begins to recognize, and then the habits begin to change. The habit is no longer simply fed through the amygdala of having food to deal with the depression, but rather the person then sits with themselves, does the self-study, and begins to identify these different components of their nervous system and say, okay, well, I'm going to first work on this. I'm going to work on the area that I can turn off my Instagram account because I have power over my Instagram account. I don't need to necessarily be on it. Number two, I'm going to begin to listen to maybe a meditation every night about how happy I am and how I actually have a good body weight and I have a good recognition of my body weight. And by listening to this 5-minute podcast every night, I'm going to begin to let my cortex absorb in this more positive mentality. And then eventually, I think the patient or the person begins to make changes in their lives, and these new types of behaviors begin to be integrated rather than being sort of reactionary, like I mentioned. So that's a little bit of a longer neuroanatomical explanation with some of the limbs of yoga, but I thought it may be useful.
That was profoundly rich and diverse. I think people listening would have felt a lot of relatability to that and appreciate the complexity that you shared. I mean, I certainly did. The prefrontal cortex practices of whatever it is, I wonder if yoga can be generalized. I think of this a lot, actually. I teach about the idea of how might your 30-minute, 1-hour yoga practice or meditation generalize off the mat or off the cushion into these other dimensions of your life? It's an interesting question I invite people to consider. I wonder if you have any thoughts on that. And before that would be just the piece around the prefrontal cortex, one pointed concentration on one thing. What I really enjoyed hearing in your share there was how that communicates to the big brother, the amygdala, to you said calm or chill for a moment, and then the little brother sort of remembers that space of non-reactivity or a different pathway, or just focusing not on reacting but on this one pointed focus that, again, you communicated in a really rich way, the diversity of intelligences and brain areas that we have the capacity to work with. I guess it just really stood out to me is, I mean, earlier in our conversation we talked about volition and agency, the capacity to have some autonomy over our experience, and you're adding the neuroanatomy. When we focus one pointedly on one thing, you give practices like breath work, meditative posture. I mean, maybe we could talk a little bit about that, but vinyasa yoga as a connecting breath and movement, focusing on that one thing for that hour. I guess maybe I'll pause for a moment. I'm curious if you do have any comments on, does the practice of the meditation, the one pointed focus, or the yoga practice, whether it's 10 minutes, an hour, whatever, generalize off of the mat into when you're maybe about to send that text message, or, into our life? Yoga on the mat, yoga off the mat.
Yeah, I think it certainly does. I think before we get into that, I'm going to just broaden the conversation, because I think to the listeners it's important, because many times when we talk about single pointed concentration, so focused attention meditation, we call it FAM, focused attention meditation. This is by definition yoga. And when we look at His Holiness the Dalai Lama, he will talk about compassion-based meditation, which is very different. And I will tell you that in just a minute. And then the second one, or the third one, depends on the way you look at it, is something that's called mindfulness-based meditation. And so earlier in today's podcast, we talked about valence and agency. And so where the yoga focuses on the prefrontal cortex and the focused attention meditation, The mindfulness meditation is more open awareness. And
Mm.
because it is curiosity, open awareness, we're often delving into the posture cingulate gyrus. We're not just in the prefrontal cortex.
Okay.
So we've moved now away from being purely focused attention like the yoga practitioners do. And with mindfulness, we're able then to sit back into the posture cingulate gyrus back over here. And what that allows us to do is it allows us to be curious about the way the conversation is unfolding, curious about the fact that maybe I don't actually know everything in this conversation, and maybe I'm going to listen to
Mm.
what may emerge from this conversation.
Mm-hmm.
And then finally, the compassion-based meditation, which is the Buddhist way, His Holiness the Dalai Lama. And so, whereas mindfulness talks a lot about let us be curious and let us be aware, neither yogic meditation nor mindfulness practice is actually doing something for the other person.
Mm.
So, in compassion based meditation, the Buddhist way, they believe now that we have decided that, yes, we are meditating, but now let us use the vehicle of compassion. Not that I am compassion, but let us use the vehicle of compassion
Mm.
to see what we can do to help this individual. And so the benefit of this, whether you do an open heart meditation or whether you do a open breath meditation, is this idea about bringing compassion and the vehicle of compassion so that everyone can be healed.
Mm.
And the beauty behind this is that we then just take a ride in the car that is called compassion. And we are all riding in the car together, and we simply get on and get off whenever we want to. But it is the power of compassion that is doing the healing, not the actual individual practitioner. Now, bringing this back to the vinyasa flow and this focus concentration on and off the mat,
Yeah.
what I do is I practice very commonly. So one of the techniques I do quite regularly is my glasses. So for example, if I'm in a patient scenario and I need to focus my concentration, I'll often put my glasses on. Many people won't know what I'm doing, but I actually held my glasses for about 3 seconds longer than I would in most cases. Or many practitioners are touching a phone every day to make a call to the operator. So what I tell everybody during that 1 minute is that when you're holding on to an object, actually feel the object. And just that one opportunity to hold the object and feeling it is enough for the focus attention meditation to be occurring. So the minute that happens, there's a dopamine spike that begins to occur in the brain, and then the prefrontal cortex is activated, and then it's released. And so many times throughout the day, if you continue to touch your glasses, touch the phone, you're activating that prefrontal cortex over and over and over again. And so in many ways, you're then strengthening that part of the nervous system. So that's a simple way of doing the focused attention meditation on or off the mat. The other way that you can do it is you can do it, and I've brought it up with the see, and I've talked to you about the hear. So we call it the see, hear, and feel. So many times you'll see something and you'll focus on it. And the idea is just to focus on it for 2 to 3 seconds longer than you normally would, and then to release it again. And so this activates the visual cortex, prefrontal cortex, and then releases it. Or you may be in a conversation that's very rich, and then in the background, you hear a bird that's whistling. And so you listen to the bird whistle for 3 seconds, 2 seconds, 1 second, and then let it go. And so then this is Heschel's gyrus, the auditory cortex, getting activated. Then the prefrontal cortex gets activated. You get a dopamine burst, and then you let it go again. So these are all focused, attentional meditations, whether that's visual, whether that's auditory, or whether that is tactile by holding on to something. And many of us have glasses, or many of us have our elbow, so you can do it kind of throughout the day in very small little bursts. But then over a prolonged period of time, this ends up being this very continuous long burst of dopamine, which is very similar to Instagram, if you think about it in many ways, because
Right.
Instagram is a very touch-based and a very visually based and a very now auditory based
Mm.
learning mechanism. So now that when you touch on someone's profile, not only does the video start going with the reel, but then the
Mm.
music gets activated quite quickly,
Mm.
and the attention is really drawn to that by your finger, and you have the opportunity to swipe or not to swipe. And so this is activating multiple areas of the focus attention meditation. So
Mm.
many people in Silicon Valley um, have studied meditation in great extent to
Mm.
strengthen the Instagram profile.
Oh, yeah. Wow. I really appreciate you taking the time to just differentiate several forms of meditation. It makes me really curious about intention and intentionality.
Mm.
I'm curious if there's even any, yeah, like you can intend on, sometimes people share in yoga or other teachers say like maybe your intention for coming to yoga is to move and breathe with a sense of compassion. I'm going to cultivate compassion through this focused attention meditation. It's going to be compassion based, and I'm going to approach it also with a mindful, open, curious posture. Can you stack those meditations together in
Hmm.
one?
Yeah, of course you can. Yeah, as long as
Yeah.
you have the language, as long as you have the language, which
Huh.
I just taught you, of
Yeah.
the different components of it, absolutely you can
Hmm.
stack them on top of each other because the reality is that each of the different meditative techniques that we've just talked about, focused attention meditation, which is predominantly yogic,
Hmm.
mindfulness, which is very much open awareness, curiosity, non-judgmental, and
Yeah.
then the last one being compassion based. All of these three different types of meditations activate different neuroanatomical structures.
Hmm.
And so,
Wow. Yeah.
because the different neuroanatomical structures are activated, it only makes sense then that the practitioner should try to activate as many parts of the nervous system that they can. Many people are doing it without even them being aware of it.
Yeah. I mean,
But absolutely. So, I
yeah.
think this idea
Yeah.
of stacking is very important.
Wow. I'm so glad I have a neurologist here to just affirm affirm that. Well, okay, I want to ask you one more thing that sounds really important. Uh, Pranayama as a breath practice. People are talking a lot about this, whether it's in the field of yoga or Wim Hof or cold cold dipping and so forth, the nervous system as we access it through the breath. But one specific question I'm curious about, because we talked about the amygdala, the fear center of the brain, as it's been called, the hippocampus, the smaller brother. Um, a curiosity I have. You were talking about the example of holding the glasses, choosing to pause, or before you pick up the phone, like choosing to pause. What about the breath? And I want to preface my question with something I notice. It's my own self perception, my own svadhyaya, my self study as a human being. But when I'm talking to people in the context of counseling therapy, I'm watching how they're breathing. I'm watching how they're not breathing when they're talking about the thing that scares the shit out of them, or the
Mm.
thing that they're afraid to talk about, or what's going on in your body as you just mentioned this piece around your relationship with dad or your upbringing. you know, I could give you many examples. My curiosity here has to do with the somatic experience. And I like to try to invite people in my yoga classes and in my psychotherapy practice to bring awareness to their body and their breathing in particular, their respiration rate at different times in the day, to notice their thinking and their feeling and what they're doing with their behavior at that time and how they're breathing, just to amplify the self-awareness. So I'm just curious if somebody who really teaches pranayama, has any thoughts on that
Mm.
topic.
With pranayama, which is for those who may not have heard the word, is about breath control. And the idea is that prana is a type of energy in the body, and yama simply means to restrain or to lengthen or to bring under control. So, one of the most important parts of the breath, as you've mentioned, John, is to be the witness and witness it in all of its magnificence. So, because the autonomic nervous system regulates the breath control,
Mm-hmm.
like you mentioned, the normal rest rate should be about 14 to 16 per minute.
Mm-hmm.
And then when someone is getting anxious, they start breathing quite rapidly. And when someone is very relaxed, their breath rate falls below 12, sometimes even below 10, depending on how experienced the pranayama practitioner is.
Mm-hmm.
Now, the idea then is that because for many decades, we felt that the automatic nervous system or the autonomic nervous system was beyond our control, we didn't pay too much attention to the breath control. But over time, and many of the studies in the late 1950s showed that advanced pranayama yogis could actually begin to regulate breath, could regulate heart rate as a result of it, and then could begin to regulate body temperature. Like you mentioned, some of the more recent practitioners of Wim Hof, etc., being able to regulate different parts of their body. So I would agree that when I do teach the pranayama, most of it is very elementary still. Most of it is just allowing people to understand that there is a right nostril and a left nostril, and various levels of understanding heating and cooling practices. And I think that this is important because then the practitioner can then have a more intimate relationship with themselves, such that perhaps when they are getting overheated, they can use cooling breaths.
Mm-hmm.
When they are getting awfully cold and withdrawn, they can begin to use a heating breath to allow themselves to become more engaged. And even balancing. Many pranayamas are balancing, samavritti, nadi shodhana, and that just simply means equal action breathing or alternate nostril breathing,
Mm-hmm.
just to simply regulate the nervous system and bring it back to some level of homeostasis. And it is amazing. And I do it many times with a lot of my residents while we're on call together, and I can see them getting quite agitated because the call is not going the way they want to. So we simply do some samavriti for 5 seconds, and they're always impressed about how the rational thought begins to reemerge. And the reason that this is the case is that it has been shown time and time again that with pranayama practice and further control of the autonomic nervous system, that the bigger brother is dampened, and the amygdala automatically gets feedback from the autonomic nervous system to dampen down. And so its ability then to race the heart or its ability then to quicken the breathing is not accessible to it because the practitioner has begun over a period of time to learn to control their compliance of their lungs or the elasticity of their arteries or the contractility of their heart. So it's no longer under the pure control of the amygdala, but it's actually under the control of the practitioner.
Yeah. Wow. So the svadhyaya, the self-study continues. You get to observe
Yes.
for yourself. This is something I appreciated from just, if you just read Patanjali's Yoga Sutras, various authors. I appreciate B.K.S. Iyengar's authorship and translation of the sutras. But what I appreciate about yoga as I understand it, the path, the 8 limbs, is here's some things to try. Here's some techniques. Here's an approach to life that has shown to reliably over hundreds, thousands of years support people, human beings, in discovering for themselves a connection to life that's really life-giving, for example. It could be said in many ways, but try it for yourself. Don't take my word for it. Here's a few things to try and observe and verify for yourself. This is something that stands out to me. I wonder if do you see it that way as a practice of experiential wisdom? Not It's not like dogmatic and you must, although that was an interesting you must practice. We must practice, but any thoughts on that?
Yes. So first, yes, you must practice,
Yeah.
without a doubt. Yes, because
Uh-huh.
uh, no matter how much we read and no matter how much we learn,
Mm-hmm.
and both of us are very learned and both of us are very experienced individuals, we must practice.
Mm-hmm.
And so that in any art form, particularly the East, we must practice. And so I agree with you that, Patanjali has set down these simple tools for us to pick up and do a
Mm-hmm.
series of postures,
Mm-hmm.
follow a set number of observances, and do a few simple breathing and
Yeah.
meditative techniques, and the benefits will show themselves. And
Mm-hmm.
anyone that has meditated with me or anyone that has done one of my yoga classes always leaves the same way,
Yeah.
saying, wow, that was quite something. I never thought that
Mm-hmm.
that's what yoga could be like.
Mm-hmm.
And I say, well, now the most important thing is, will you practice yourself
Mm-hmm.
every day without fail?
Yeah.
What will you do for yourself? And
Mm-hmm.
it's actually quite impressive now, because I think we've now moved to a world of greater level of simplicity.
Mm-hmm.
And getting back to your original topic, which was, we are in a busy lifestyle, so people are busy doing this, busy doing that. We have to make the time for the simplicity in our lives. And as we begin to become simpler in our lives, we'll begin to understand that these simple tools that we've always had access for hundreds of thousands of years can simply be used once again. And so, as you know, and we've talked about this before, we are very fortunate to be in the Kali Yuga.
Mm-hmm.
And for those who don't understand or don't know, yugas are generational templates of where we are. And so we personally right now are in a age called the Kali Yuga. And why we are so drawn to excesses is because we exist in the lower chakras. And the lower chakras being the Muladhara chakra, the Manipura chakra, and the Swadhisthana chakra. And because we live in this world, we are very much drawn to excesses and material goods. However, in many ways, because we are so far away from spirituality, it is very easy to achieve it by
Mm-hmm.
doing simple practices. The difficulty is doing those simple practices becomes very difficult because of the excesses. And because the excesses are so easily accessible to us,
Yeah.
this is why we are excessive. And that's why many of us cannot simply sit and meditate for even a minute, never mind 5 minutes. Simply devoting 1 minute to a calm app seems to be quite difficult for the majority of people.
Mm-hmm.
And that's not to say that this is your fault. It's just a simple reflection of the age that we are in. Whereas once the Kali Yuga ends and we enter back into the Satya Yoga, and this yuga is a very long yuga lasting tens of thousands of years, everyone is enlightened.
Mm-hmm.
And everyone sits and we meditate, and we are not driven to excesses. But in many ways, because everyone is enlightened in that age, to get anything done is very difficult.
Yeah.
Because we are not based on the material, we're based on the ethereal. And once we are based on the ethereal, that's for another conversation, for another yuga discussion.
Yeah. A follow-up question here. So you mentioned we here in the West, it's a culture of simplicity. It's a culture, I've heard it expressed as a culture of convenience and excess. I want to ask you as a teacher, yeah, it's a question about the role of the teacher in this time of much distraction, much excess. What what role, what value do you see the teacher playing to support people in, yeah, I guess awakening, you could say, but even trying something different?
Hmm. Yes, I think when we look at the yogic teacher, the guru,
Mm-hmm.
and the disciple or the siyasa, BKS Iyengar brings it very clearly. So when I was very young and I had been practicing yoga for quite some time, I had made it um, part of my discussion on my arms
Oh yeah.
to be very, very clear as to what a guru is.
Mm.
And so a guru is clear in his perception and knowledge. And so this is very important because for me to be able to perceive and transmit knowledge, I must be very clear in my self-study.
Mm-hmm.
Means that I must study more than any of my pupils because my perception has to be clear.
Mm-hmm.
The next one is regular and spiritual practice. This is
Mm-hmm.
very important that I must have a spiritual practice that honors Rajive and everything that I'm willing to learn. I have to be constant and determined in study, meaning that I must continue to study myself and I must continue to read. A guru is free from desire for the fruits of his actions, which means that ultimately I am a success already. But part of my success moving forward now is how do I educate those around me and letting them understand that don't worry so much about the results, but really enjoy the journey that we are all on. Pure in the guidance of his pupils in the true essence of knowledge. And so when we guide individuals along the way, we always want to show them the path that is right for them, not the path that is right for me, but the path that is right for them. So in many ways, the guru knows before the journey has begun what are the characteristics of their pupil. They have studied their pupil at great length, and they know in many ways much, much more than the pupil even considers of themselves or of their journey. So then it becomes very easy for the guru then to sit and put together a set of instructions for that pupil to make them move forward. And in many ways, I feel that we do that with our trainees or with our patients and with the people around us. We are all in a great relationship with each other and we're all allowing ourselves to educate each other in what the next steps may be for ourselves. So that's a little bit about what I think about the guru and the
Yeah.
siyasa role.
Yeah. Thank you for sharing your personally embodied and embroidered
Hmm.
reflections with us. That's really
You're
powerful.
welcome.
Something I'm tuning into, and I also want to honor our time. We're getting on here, so honoring our container. We're both men here talking about yoga, coming from diverse backgrounds
Mm.
at this time, at this recording, July 2024. I hear a lot from men in particular. I want to try yoga, but I'm not flexible.
Mm.
I've heard that like hundreds of times. It's a gendered question, inquiry, topic. I often feel as though there's a misperception of what yoga is, and I hope that part of our conversation has been elucidating a little bit more, and um, I I could continue speaking on this right now, but I'm curious if you have any thoughts or reflections for potential men who might be listening to this conversation. Um, yeah, or is this been something you've heard before? Or is it just me and my counseling practice? Men that want to try it, but there's intimidation and resistance to it.
Yeah, I think that, part of what you talk about is this flexibility or this lack of flexibility.
Yeah.
And I find that it is mainly because of the male brain. So the male brain is very different than the female's brain and the way that it's
Hmm.
necessarily wired. So there's no doubt that there's a masculinity behind this flexibility component.
Mm-hmm.
And mainly because men are driven by a physical predominance. And so this is why the asana practice is so difficult for them, because to come into a place where there is no resistance necessary, it is just simply standing, sitting, lying, it becomes very difficult for the masculine to sort of sit into a more passive posture or a more um, resistanceless
Hmm.
posture. And this is why I feel in many ways this lack of flexibility is what a lot of men talk about.
Hmm.
But it's interesting because then once the practice does begin for many men, I find that they are the ones that over time become more flexible as they begin to recognize that it is usually their own preconceived ideas
Hmm.
as to what needs to be considered a bodily practice. Because
Hmm.
in the West, at least, we've grown up thinking that we have to run or we have to push weights or we have to, um, scale mountains. And then doing a posture sequence where you're on a mat, not requiring a lot of that resistance and a lot of that extra resistance is what becomes very difficult for the masculine. Whereas women, I think, in general, are much more open to this idea and this concept about flexibility. Many women, in particular, have more flexible nervous systems, meaning that they can regulate themselves probably through childbirth, probably through menstruation. They're able to regulate themselves because we never got too much into the hormonal neuroendocrine
Hmm.
system, but because they have much more exposure to those estrogen dependent mechanisms, I feel that their flexibility is considerably heightened
Hmm.
and accepted compared to
Hmm.
the masculine physique. At least that's my perspective.
Yeah. Well, thanks for speaking to that. Um, I probably was one of those men many, many years ago, but I hadn't had much exposure to yoga nor women or people influencing me in yoga. But
Mm,
I'll just share briefly as a man here on this podcast. I had many years ago a first power vinyasa yoga practice. And something I still think of now to this day, and what a benefit I receive out of that practice is something about the diversity of connected breath with movement
mm,
seemed to support, from one perspective, uh, bringing my attention into the present moment. Um,
mm,
Almost as if to say, I realized like after that, I was like, whoa, like I'm not really focused so often. Prior to that, I didn't really know about ADD, ADHD. But as I think
mm,
back a long time ago, it seemed to be sort of a medication for what I didn't know was like an agitated sort of
mm,
um, attention deficit like manifestation of my mind. But through the connected movement and breath practice, it brought that attention
mm.
into. Also, I felt amazing after the first. My system was buzzing. The euphoric sensations in my body were really like nothing other compared to the bodybuilding, weight training, calisthenics I
Mm.
was into prior to that. So there was something to that hooked me enough to
Yeah,
go become a teacher, basically. But um,
yeah,
yeah,
sounds pretty exciting just listening to you talk about it.
uh huh,
Yeah, it
yeah,
sounds like it really opened up something for you.
it did. Yeah, as well as the collective environment. I was doing the
Mm,
lone wolf thing, kind of, at the gym, um,
mm,
doing the pushing of the weights. But it was a transitional time in life where I was starting to be more interested in. I started to wear ear plugs at the gym to listen
mm.
internally more and to listen to my breathing. So there was a kind of an evolutionary
Right.
natural progression towards this. That was like pratyahara, the
Hmm.
withdrawal of the senses turning in. Um, so maybe it's a part of the evolution,
Yeah,
but I,
that's
yeah,
that's very true. That reminds me of where I meditate the best. I meditate in very busy gyms.
yeah. Oh, interesting.
Yeah. So that's where I find the greatest practice. So
Huh.
my wife and I joke about it, but
Yeah.
where I sit now, I have to put many kettlebells around me because many times if I don't put the kettlebells, people walk into me because they don't see me meditating.
Oh, yeah.
So it's been quite a nice experience.
Mm,
Very loud gyms,
Yes.
And those are the best places to meditate now.
Louder the better.
Exactly.
Wonderful. Well, we have sure covered a lot of terrain in
Yes.
this rich dialogue. Is there anything that feels in you, in your heart, in your being that feels left a little unsaid that you want to maybe speak to before we transition?
One last thing I like to always bring up, which I think is important, is the path. And the path is different for all of us. And so we must all remember that although we are talking today about yoga, we're talking about Ashtanga and um, the eight limbs, keep in mind that everyone's path is different. And as we go along our path, we will be shown what is important in our next iteration. And this is the Ishvari Pranidhana, which is the devotion to a higher power. And as long as we stay connected with that, we will then continue to move in a meaningful way to the prosperous future that we all are guaranteed to be awarded as long as we stay in tune with that. And that's what I'd like to end with.
I will breathe in to that. Thank you.
Thank you very much.
Yeah. What a pleasure and honor to have you on the podcast and speak with you in this.
Yeah, thanks, John. It was a great, yeah, it was a
Mm-hmm.
great experience. Thank you very much for taking the time, everyone.
Mm-hmm. I will say that I took ample notes and many neural branches came sparking off in our conversation. So I will reach out to you and perhaps it might be generative of another rich conversation someday.
Yeah, that sounds great.
Mm-hmm. Mm-hmm. Okay. Well, enjoy your time off. And yeah, thanks again for coming and speaking with us here.
Yeah, thank you very much. Yeah,
Mm-hmm.
thank you.
Okay. Take good care. Bye,
Bye-bye.
Rajive.